Hi, this is Dr. Paul with carinjurycare.tv/Citrus Park, and we answer common questions about auto accident injuries. And the question we're talking about today is the importance of compensation and how you're compensated. And one of the main guides we use is what's called the AMA Guides to Impairment Rating. So we're talking with Dr. Wallace Wade here in Citrus Park about that. So let's go ahead and talk a little bit about the importance of the AMA guides in a patient in their compensation, in documenting their injury, and how it's used in personal injury cases. Now, first of all, what are the AMA impairment guides?
Well, they're guides that rate impairment of what the patient is unable to do. Their normal daily activities of sitting and walking and doing sports and other activities that we normally do, those are rateable in the guides. Their range of motion, they might not be able to move their neck or their back as well as they did prior to that accident. And they're rateable in these guides. I'm certified in that area, and that is it's a gold standard of coming up with different percentages of how that's affecting this patient in the future. And they're rateable in those guides, and they're compensated by the percentage of impairment that they have.
So these guides, you're telling me, essentially take the injury, put it into a number, and then based on that number, the patient is compensated.
Absolutely.
That's okay. And what are some of the main categories that the guides would look at relative to compensation of an auto accident injury?
Well, range of motion. Is this patient able to turn or move their neck or their back? Mm-hmm. Another one is a disc injury. If they have a herniated or a bulging disc, that's a rateable compensation of their problem. They're going to have difficulty in the future. They have a permanent injury and they're going to have a difficulty with that. Other activities of daily living that they would normally be able to do. These are compensated by that percentage that affects that person in the future.
So some range of motion, you said, disc injuries. What are some tests maybe that would be done to qualify or substantiate these limitations or restrictions? What would be some common tests that would be used to help with the AMA guides?
Okay, there's the MRI, which is magnetic resonance imaging. It looks inside of the body. It's different from an X-ray, and these are rateable if there's problems with the ligaments that hold the bones together in the neck or the back. Nerve conduction studies. That's a study running an electrical impulse down into the arm, and this person may have numbness or tingling in their fingers or their arm, or they may have inability to move their arm or their leg or in their back. So these studies help in determining the permanent injury that may have happened from a neurological standpoint and orthopedic standpoint.
Now, can you perform these tests?
No, I have to send the patient to an MRI center that they get the MRI done at.
What about a range of motion? Can you do range of motion studies?
Well, I can do range of motion studies in the office. That's rateable. I could do X-ray range of motion or exovideography that looks inside of the body as they move their body part.
Okay. So most of these tests you can do. The MRI you would send out and have that done. You could measure strength, I take it?
Right.
Okay.
Muscle testing would be another test. I can measure that strength.
So of all the different measurements that are used in the impairment guides to determine these limitations, it sounds like you have the ability to personally to do them yourself here in your office, or you would refer them out to get them done. Is that what I'm hearing?
Yes.
And then what would you do? You get all this information, okay? Mm-hmm. Now what do you do relative to the guides with that information?
Well, I look in the guides and look at the information of what those are rateable for and what kind of percentage there is in the inability to move their head or neck as well as they should, or their lower back, or rateable if they have compression, nerve compression. That is rateable by that nerve conduction study. So we look in the guides and come up with a percentage of that particular injury of how they're going to have trouble in the future with this.
Okay, and then you can do this, and then you actually give it to the attorney.
Yes, I give it to the attorney,
Okay.
and then he can take it and look from a legal standpoint of what type of compensation they should be awarded because of these injuries.
Okay, so this is how it's compensated then? Is
Yeah,
that what you're talking-
absolutely.
Okay. And are you certified in impairment rating?
Yes, sir. I'm certified, and I keep up with that on a yearly basis, making sure if there's any changes in those guides that I'm on top of it.
Okay, well, that's interesting. All right, well, this is, again, Dr. Paul with carinjurycare.tv/Citrus Park, where we answer common questions about automobile accidents. And we have over 50 free videos with Dr. Wallace Wade here at Citrus Park that will answer your most common questions regarding auto accidents and injuries, medical, legal. So head on over there now and you can pick up those videos. It's carinjurycare.tv/Citrus Park. Head on over there and pick up all the videos and the free information that Dr. Wade has put together for you, okay? Head over there and we'll see you over there. You take care. Bye.